Hello and welcome to This Month in Optometry Science. This is the pilot of a hopefully regular series in which we are looking at some of the latest research. To make this video, we go out to optometrists in practice to find out what's caught their eye. This video is from Josie Evans, who identified 4 intriguing studies and what can be learned from them. If you'd like to know more, the links to the studies are included in the video description, as well as the cards at the top corner when these studies are discussed. Does offering only the spherical contact lens trial to the low astigmats mislead practitioners? This study investigated the differences between spherical and toric contact lenses in low astigmatic patients, with the aim of determining whether toric contact lenses offered a significant benefit to patients. 40 patients were recruited with astigmatism between 0.75 and 1.25 DC. They were fitted with either a spherical contact lens or a toric contact lens over the 2 days. The study was performed as a crossover, with the participants receiving an SCL on one day and a TCL on the other. The patients were masked to the lens design, however the practitioners were not. Their visual acuity was assessed after 4 hours of wear, and subjective responses were recorded for vision, comfort and preference. The results revealed a one-line improvement in the monocular visual acuity with toric contact lenses, although binocular visual acuity remained similar. Subjectively, patients experienced less visual fatigue with toric contact lenses, and importantly, there was no significant difference in comfort. With toric contact lenses, 100% of the patients described their vision as very good or good, which reduced to 80% with spherical contact lenses. Furthermore, of the 33 patients who wished to continue with contact lenses, 26 preferred the toric design. The authors note that present evidence suggests it is common practice to fit the spherical equivalent in low astigmatic patients. However, their findings show significantly greater patient satisfaction with toric contact lenses. Subsequently, they conclude that a toric contact lens should be offered as a first choice in a contact lens trial. High-fat diet induces inflammation of the Meibomian gland. This study researched the effect of a high-fat diet on Meibomian glands in mice models. The induced cholesterol levels were similar to those in hyperlipidemia in humans. The group had previously found a connection between hyperlipidemic mice and dry eye-like ocular surface damage. Several tests were used to assess the Meibomian glands and anterior eye. The eyelid margins and cornea were imaged under a slit lamp microscope, a variety of stain tests were performed, and RNA was extracted. The results suggest a high-fat diet induces pro-inflammatory cytokine expression, resulting in chronic inflammation in the Meibomian gland microenvironment. Following this finding, the mice were fed a standard diet for 4 weeks, and the inflammation markers fell significantly. The authors conclude that diet control may be a possible therapeutic strategy for high-fat diet-related Meibomian gland dysfunction. To implement this knowledge in practice, the TFOS-2 patient summary report recommends educating patients on dietary modifications in the first step of their dry eye disease management. Long-term outcomes of collagen crosslinking for early keratoconus. The authors aim to assess the long-term outcomes of collagen crosslinking, which uses riboflavin and ultraviolet A to enhance the strength of the cornea. 30 eyes with early progressing keratoconus were enrolled. Patients were examined before crosslinking and again after 3 months, 6 months, 1 year and 9 years after treatment. The uncorrected visual acuity and best spectacle corrected visual acuity remained stable at the final appointment, after improving significantly in the first 6 months and gradually returning to preoperative values by 12 months. The mean objective spherical equivalent reduced considerably from preoperatively to the final follow-up, although the subjective remained similar. The mean subjective cylinder value also reduced significantly. The authors recommend collagen crosslinking for patients with early keratoconus, highlighting the procedure's good safety profile and effectivity at stabilizing progression over a long-term follow-up duration. The take-home message for optometrists in practice is to continue referring patients with suspected early keratoconus for formal diagnosis and assessment for possible collagen crosslinking. Visual function in patients with Fuchs endothelial corneal dystrophy. This study retrospectively analysed case records for patients diagnosed with Fuchs endothelial corneal dystrophy. A total of 107 eyes were assessed for best corrected visual acuity, Peli-Ronson contrast sensitivity, and corneal alterations including central corneal thickness, depression of the posterior cornea, and epithelial thickening. The analysis shows that contrast sensitivity was negatively correlated with age and corneal alterations. However, best corrected visual acuity was not. The authors therefore suggest contrast sensitivity should be used to assess visual dysfunction in patients with Fuchs endothelial corneal dystrophy. Furthermore, they conclude that corneal alterations, for example central corneal thickness, may be useful objective parameters for monitoring progression.